Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator here with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy, all the way from the country of Mali. Dr. Murphy, how are you today?
Doing quite well. Nice and warm here.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, or infectious disease each week here on the Havey Institute for Global Health's Facebook page. Starting today, will we be addressing the latest headlines, news stories, and U.S. COVID statistics through today, February 28th. If you have any questions or suggested topics, we invite you to submit them down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting with that COVID statistic, average COVID deaths per day in the last reported week were 78. The same week in 2024, we saw 231 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the general state of COVID in the US?
Yeah, well, remember the death rate always is the last metric to change because those people were infected many weeks ago and then they just got sicker and sicker and they didn't make it. So the amount of virus found in wastewater and these surveillance systems has fluctuated between high and medium now. So what we're seeing is the kind of the end of the peak, which is very typical. This is how the viral cold season works. And we'll see it continue to go down in March and further in April and pretty much be done with the peak by the end of April. That's the classic approach. And the other good thing to look at is that compared to last year, it's much better, much lower, much fewer serious disease cases and fewer deaths.
Mm-hmm. And on the topic of COVID, we got a really interesting question from a longtime viewer who asks, do you have any idea what percentage of the US population never got COVID?
Yeah, well, we don't know exactly, but what the CDC does when they're allowed to do their job is they do these surveillance studies. So they'll go into a population, just test everybody, or a blood bank where people have been donating. I mean, things like that. And they found that surprisingly, between 12.5% and 25% of people may never have had COVID. In other words, they don't show any antibody at all. So either they had antibody and maybe it wasn't very much and it went away, or they just were never exposed. So, but it's higher than expected.
Very, very interesting. And hopefully we'll get more serological studies on that front, but we do not know.
You're right.
However, something we do know a little more about is the measles outbreak centered in Texas. It's been a huge story over the last few weeks, and there have been some huge updates this week. Can you fill us in on all that's happened?
Yeah, well, we're talking about this outbreak in Texas and in the border county in New Mexico that's right next to it. It's up to 133 cases. There are cases, of course, popping up here and there around the United States. The unfortunate thing is that one child, a school-age child, has actually passed away from measles, and 18 people, mostly children, have been hospitalized out of the 133. It's a serious disease, and it's a preventable disease. And the reason why the outbreak is so big there is because they have a very low vaccination rate. It's one of the lowest in the country, actually. So when you get below 93%, 94% antibody protected, immunologically protected, either from having measles in the past or having the measles vaccine, you're going to see this happen. So it's very unfortunate. They've also had a couple people from that area that got sick, had visited a couple college campuses. I think the University of Texas San Antonio and Texas State, and no cases have been reported there. But this measles is highly contagious.
Absolutely. And that is a big jump in cases from last week, which I believe we reported was at 58 at the time of recording, and now it's up to the 130s. So that is a big jump in 1 week, and we will continue to report on those numbers.
Yeah, and remember in 2000, there were no cases when the vaccination rate was really high, was well over 90%. So that's hopefully where we can go back to.
Mhm. Now, a couple of weeks ago, before this outbreak, we were talking about a previously mystery illness in Congo. It was identified as severe malaria, but there have been a couple of warning signs coming out of Congo as there is an outbreak of another now unidentified illness. Can you tell us about those case numbers and if you have any idea what it could be?
Well, it's very similar to what happened a couple months ago. 53 people have died, and they die within 48 hours of presenting. Now, either they're just coming to get evaluated late, or it's a really serious, super serious disease. 419 people have supposedly gotten ill. They haven't found the usual suspects like Ebola or Marburg, those type of diseases. They found a couple cases of malaria, and it could just be malaria and malnutrition and other risk factors on top of that. We don't really know, but that's how they found. That's what happened last time, and it ended up being kind of just malaria plus other things going on that are high risk. So they're investigating it. No, this is something that has an answer.
Mhm. Hopefully, we will get those answers soon. It's something that we will continue looking into, of course. But coming back to the United States and a little overseas as well, there have been more big updates with the H5N1 avian or bird flu. More human cases, more poultry cases, and a fatality overseas. Can you tell us about it?
Well, there were two hospitalized cases, one in Wyoming, one in Ohio. The one person did get discharged, one is still in the hospital. The D11, which is the more serious strain, is especially was found in the Nevada farm worker. That person is doing okay. There was a young child in Cambodia who they only have reported two cases, and they're different strains than the ones they have here. But one of those children died. Now, remember, this whole fear about avian flu came from outbreaks in Asia where 50% of the people died. So, we'll be, of course, watching it very closely what happens over there and if any of those strains end up over here. But it's just not going away. There's still no big human to human transmission, but the birds are getting devastated, decimated. In Ohio, there was a recent outbreak in the birds. They had to cull 3 million birds. And in the last 30 days, they've had to kill 19 million birds in these bird farms and stuff. So it's just very unfortunate. So if you wonder why egg prices are up, now you know. It's just really this thing is not over yet.
And you mentioned that D1.1 strain. There was some published research in the Virological Journal that showed that that strain may have jumped from chickens to cows as early as December. And
Mhm.
this is something that came on our radar in early February. With that big gap of time, are there any big implications or consequences of us not catching it?
Well, um, that's just not that unusual considering how basically inadequate the surveillance systems are. Now they're not inadequate, but they're underdeveloped and they could be improved. Let's put it that way. I'm being very polite. Um, if that had been a very lethal strain or something that could jump from human to human, waiting that long would be really not good. But that's not the case here. And they did figure it out, and it's only late February. So it was probably circulating for about 2 months. Um, so that's not too bad. But we have to really be vigilant with this because this ability to mutate and then spread human to human that's a real risk.
Something very scary that we do not want to happen. And
And the
our
human transmission has not happened. So, I mean, we have to just be honest with ourselves. It's devastating for the birds and the cattle and who knows what other animals. But it it has not gone human to human yet. So that's good.
Yes, very good. Now, our final story for today is a JAMA network study about the use of Paxlovid and the efficacy, of Paxlovid now that more people are vaccinated and have herd immunity. Can you tell us about those results?
Yeah, so these studies that are being done looking at big groups of people, I think this was a group in Canada, elderly people with some underlying disease over 65, they didn't see really any difference in the outcome. And so why would that be? And this is the trouble now trying to develop a better drug for COVID when there's so much natural immunity. So it turns out the the natural immunity from having prior infections and from having been vaccinated is really enough to help the people that are infected. And that's why these death rates are going down so much from last year. So it's not that the Paxlovid doesn't work, but in many people now, you don't need it. But if you're very immunocompromised and fragile, whatever, it's okay to take it. And it's still approved for use along with a couple other drugs. And, if you get really sick, hey, these are just statistics, like it is an antiviral drug that had proven itself effective. So, but, this is really now a doctor-patient decision, even in people at high risk.
Mhm. So don't be dissuaded when you see changes in those numbers. It still can be helpful, just maybe to a
Yeah.
lesser extent if you are vaccinated and taking care of yourself in other ways.
Yeah, especially if you've been vaccinated. Those people tend to do better than the ones who had COVID but weren't vaccinated, which may sound counterintuitive to a lot of people, but that's been shown over and over again to be the case. So, but it's basically not as necessary as it used to be.
Absolutely, which is a good sign looking into the future. And on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise breaking down these stories, the studies for us. It's very much appreciated.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. Thank you for your viewership and your questions. If you have any additional questions or any suggested topics, please leave them down below or at any of our social media. We'll see you next week and have a great weekend.
Bye-bye.